Okay. Hello. Knock,
Hi.
knock.
Oh, hi.
My name is Natalie. I'm going to be your nurse practitioner working with you today.
Mm-hmm.
How are you?
Good.
All
I'm
right.
Andre. It's nice to meet you.
Hi, Andres. What's your last name?
Paz, P-A-Z.
And when's your birthday?
November 13th, 1997.
Awesome. All right. Are you familiar with nurse practitioner?
No.
Okay. Well, we can get started. Let me get some hand sanitizer. Okay, so as a nurse practitioner, I am licensed to train, assess, diagnose, and then just kind of manage a wide range of health conditions. I can also order tests, prescribe medications, and kind of help support you
Mm-hmm.
kind of in all different aspects of making an informed decision about your overall health, okay?
Mm-hmm.
I work with I'm part of a healthcare team. I work with different doctors, specialists, other nurses, and professionals just to kind of receive well-rounded, holistic, and coordinated care for you.
Sweet.
So my focus is today to kind of just learn about you.
Mm-hmm.
We're going to actively listen to and then kind of work together to identify and address any needs
Okay.
or concerns that you might have.
Sweet.
But I just say you just say Andres. Andres, okay to address you by.
Yeah, that's perfect.
And then what are your pronouns?
He, him.
Okay. I will mark that down. So I just have a few demographic questions just to kind of confirm everything on chart.
Sweet.
What is your address?
2 East Erie Street, Unit 2107, Chicago, Illinois.
Okay, your phone number?
787-209-1684.
Okay, and then how old are you?
I am 27.
And then you did say you were a male. And what's your ethnicity or race?
Hispanic, Latino,
Okay, and then what's up type of Latino?
Puerto Rican.
Okay. And then who is your usual doctor or provider?
James Johnson, Dr. James Johnson.
And then what insurance do you have?
Aetna.
Okay. So why are you here today?
Flu shot,
Okay,
Yeah.
awesome.
flu vaccine.
Beautiful, beautiful. It's a good time to get it. Do you have any history of present illnesses right now?
No.
Okay. Any significant or past chronic illnesses in the past?
No.
Any hospitalizations, injuries, any invasive procedures?
Mm-mm.
Okay. And then do you have any concerns relating to your health, your well-being, or just like any potential disability?
Mm-mm.
Okay. So we're just going to go over a bunch of questions. We'll review your past medical history, kind of your social habits, and then a review system from top down. I'll ask you about the history before we do an assessment, draw some labs, and get you your vaccine.
Sweet.
Okay? All right. So bear with me because these are a lot of questions, but I see here that you were vaccinated all throughout your childhood. So I'm just going to read off, and then you tell me if there's any discrepancies or anything new, okay?
Okay.
So, rubella, rubella, mumps, pertussis, varicella, polio, tuberculosis, hepatitis, A and B, HPV, meningitis, the COVID vaccine, and then a Tdap, and then a TB test. Was this the blood or the skin one?
The blood one.
Okay. Were you exposed to anything? Did you have any adverse reactions? Did you get a chest X-ray or anything like that? Okay.
No.
Awesome. Do you have any allergies or drug reactions?
I have allergies to, an allergy to raw onion.
Oh, okay. And then what happens when you eat the onion?
My tongue swells up.
And it's just raw onions?
Mm-hmm.
Okay.
Yeah.
Do you have an EpiPen with you?
I do.
Okay. Do you have any questions regarding how to use it?
Mm-mm.
All right. Exactly. Yep. Thank you for demonstrating. So no seasonal or other environmental factors like any plants, animals,
No.
any food, other food or drugs? Okay, good. Any allergies to penicillin or latex sensitivities? Okay, good. You said no hospitalizations, no surgeries or invasive procedures. Any accidents, injury, or harmful ingestions? Do you take any medications right now?
Just multivitamins in the morning.
Okay, just the once a day?
Mm-hmm.
Okay. I'm going to go over your family history. With that, I'll kind of create a genogram, which is just telling me about your two generations, so your moms and your grandparents
Okay.
on both sides. You're going to tell me your age, if they're alive, and any chronic illnesses. So I'm going to read out the chronic illnesses that will be considered into this, okay?
All right.
So if they have any allergies, arthritis, asthma, blood disorders, cancer, congenital or genetic diseases, cystic fibrosis, diabetes, drug, alcohol abuse, emotional problems, GI disease, gout, heart disease, high blood pressure, kidney disease, learning disabilities, neurological disorders,
Yep.
mental retardation, obesity, peripheral vascular disease, sickle cell disease or traits, seizures, stroke, sudden death, sudden infant death, or any thyroid diseases. So we'll start with you. You said you have no history. You are 27 years old. Do you have any siblings?
I do not.
Okay. And then do you have any children?
No.
Okay. Mom is how old?
She is 55.
55. She's alive.
Yes, alive
Okay.
and well.
Awesome. No medical histories.
Mm-mm.
Okay. And then your dad is
60.
okay, alive.
Yes.
And any history?
High blood pressure.
Okay. And then we'll go to your mom's mom.
Mm.
Okay. How old is she?
She is 82.
Okay. And she's still alive.
Alive. She has had breast cancer.
Okay. Is she currently going through like any chemo radiation, or was it
No,
resolved?
it resolved in 2019.
Okay, and then with chemo, radiation, surgery.
All of them.
Okay, and then any other histories of hers?
No.
Okay, and mom's dad is how
Alive
old?
and well. 83. Yep,
And you said
83.
alive and well.
Mhm.
Okay, and then we'll move on to your dad. So, how old is your dad?
60.
Okay, and his medical history.
High blood pressure.
Okay, and then dad's mom,
88.
and then any history with her.
No. She's
Good. And then dad's dad.
deceased.
Okay, at what age?
78.
Okay, and then any history with his medical history?
High blood pressure.
Okay.
Yeah.
And then the reason he passed away?
It was sudden.
Okay.
Yeah.
All right, we'll document that. All right. And you said you have no siblings and no kids of yourself, and you have no medical history,
Correct.
correct? All right. Next, do you have any concerns about your the illnesses of your family nature?
No.
Okay. All right. If anything does kind of come up, then you can always reach out to me or send me a message on the app.
Sweet.
All right. So now we're gonna go to your family relations.
Mhm.
So who do you live with and kind of where?
Oh, I live in the city by myself.
Okay, by
Yeah.
yourself. Your family members? No, are your family members like in state, out of state?
Oh, out of state, yeah.
All of them.
Mm-hmm.
Okay. What do you do for work?
I'm a pilot.
Awesome.
Yeah.
And then how long have you been doing that?
Oh, 5 years.
Okay.
Yeah.
And what were you doing before that?
I was just a student.
You
Just
were
a student.
Oh, a student. Okay. And then where did you get your degree in?
Aviation flight
Okay.
management.
Was that like a
Bachelor's, yeah.
bachelor's? Awesome. What else? How do you feel about like, or do you have any concerns about any like financial resources, insurance?
No, thankfully no.
Okay. Any habits? So we're gonna go now down your habits, and this is routinely. So,
Okay.
any current or past use of alcohol
Like regular.
regularly? Okay. So what would you say, like
Oh, like-
weekly?
Sure.
Okay. And then like about how much is it a week?
Like, once a week, 2 drinks.
Okay, 2
Yeah.
drinks. So drinks like 2 beers, or is
yeah.
it 2
Yeah,
beers?
2 beers, yeah.
Okay. So so about a week, and any tobacco use?
No.
Second-hand smoking, vaping, or chewing?
No.
Any caffeine-containing beverages?
No.
Okay. And then any recreational drugs?
No.
Okay. We are going to sleep patterns. How many hours do you usually get of sleep?
6 to 8.
Okay. Any disturbances?
Mm-mm.
Okay. Good to note. Do you work out? And is this, just let me know, like, kind of like frequency, like how long, and is it usually like aerobic or anaerobic?
Work out about 4 days a week,
Okay.
and then hour to an hour and a half,
Okay.
and then
So what do you do when you work out?
lift weights, cardio.
Okay. How much cardio do you usually do?
I try to do like 30, 45 minutes.
Okay. Awesome. Thank you. I'll write that down. So what does your typical day look like? Let's just say in chronological order. You don't have to be too specific, but kind of like how does your day usually go?
Oh, just wake up, eat breakfast, go to work, depending on how long I'm at work that day. After I get done, eat, work out, sleep.
Okay. And what does your daily intake pattern? So let's just say the last 24 hours, kind of what did you eat and drink?
The last 24 hours.
So you can start in the morning and then
Yeah.
go throughout the day.
In the morning, wake up, drank water, took my vitamin, and then had eggs for breakfast.
How many eggs do you usually have?
2 to 3.
Okay.
Had that with ground beef, and then snacked a protein shake. Then ate lunch. For lunch, I had chicken breast with vegetables, 2 chicken breasts, and a little snack in the middle of the day, and then after that, ate dinner.
Okay. And what is dinner?
Fish. I had salmon.
And anything else with it?
Just water throughout the day.
Okay. How much water do you think you usually drink?
4 to 5 bottles.
Okay. Water bottles?
Water bottles, yeah.
Like the regular water. Okay. And then when you said snack, what did you mean? Kind of like what's
Like protein bars, sports and snacks.
Okay. Awesome. All right. How do you feel about your stress? Do you have a lot of stress, and kind of what's your coping? Do you feel like it's manageable?
It's just work stress, and just I manage it there.
Okay. Have you sought any outside help to deal with any problems, like mental health professionals or anything like that? Have you suffered from any emotional, physical, or sexual abuse? Okay. And then your perception. How do you feel about your current stage in life? Do you feel like you're meeting your developmental milestones?
Yeah, I think I feel pretty good where I'm at right now.
Is your work?
Yeah.
Awesome. It's good to hear. Now we're gonna go. So we're gonna get some social and kind of personal history. Okay. So this is just kind of routine.
Sure.
So do you usually get routine care, or is it just kind of like on an urgent basis, like going to the ED? Routine. Okay. You just see your Dr. James. Where were you born?
San Juan, Puerto Rico.
Okay. Were you exposed to any hazardous, like crime, violence, any like chemicals, pollution, leads, anything of that you recall? Okay. What is your perception of like health and your history when you're seeking like with your providers? Like, have you had good experiences, bad experiences?
Yeah, I think overall it's been pretty great. I haven't had an experience where it's bad, so overall it's great. Yeah.
Awesome. What are your do you have any like ethnic or religious customs that kind of affect like the health and how any practices in health?
No.
Okay. Are you religious at all?
Mm-hmm.
Okay. What do you practice?
Christian, Catholic.
Is it super significant into your life? Like, what would you describe yours, like your significance and affiliation to it?
Pretty strong.
Okay. Yeah. So we're gonna do the review of body systems, and I'm gonna go ask you from every kind of body organ from head to toe.
Okay.
We'll start with some general symptoms and then kind of just focus on those. Okay.
Sweet.
So bear with me. Have you had any history of any fever, chills, malaise, fatigue, night sweats? Any weight changes?
No.
What's your your current weight has it changed recently? Is this your ideal weight?
Yeah, I'm usually around this weight. Yeah.
Okay. Yeah. And then did you say any preferred changes? I'm sorry.
No.
Okay.
No.
Any conditions or changes in your skin, hair, molds, and
Nope.
Okay. Do you use sunscreen?
I do.
Okay. What do you usually use?
For my face in the morning routine, and then sometimes at work.
Okay. And what's the SPF?
30 to 50.
Okay. All right. Any conditions or changes in your hair or scalp that you've noticed? When was your last eye exam?
Earlier this year.
Okay. What month would you say?
February.
And then what was the outcome of that?
2020.
Love that. Okay. So no contacts or glasses, any history of visual disturbances, pain, halos, double vision, any eye pain?
No.
Okay. Any cataracts, eye infections, any family history of like glaucoma? Okay. We will move down to your ears. Any history of pain, discharge, ringing in your ears? Any besides like regular earwax, any other discharges that you've noticed? Okay. And I'm assuming you don't use any hearing aids?
No.
Sinuses, any sinus pain, infections, upper respiratory infections? What about nosebleeds?
No.
Any unusual discharge from your nose?
No.
Okay. When was the last time you seen a dentist?
2 weeks ago.
Okay, and how was the outcome of that one?
Good. No cavities.
Good. Do you have any missing teeth, prosthetic devices like dentures or any dental bridges?
Just a crown.
A crown, okay. You said no dental problem. Any bleeding gums, oral lesions, sore throats, difficulty swallowing?
Mm-mm.
Okay, what about any voice changes or hoarseness that you've noticed?
Nope.
And then what are your brushing and flossing habits?
I brush every morning and night, and I try to floss after every meal.
Okay, any mouthwash?
Yes.
Okay. Now we're going to go to your neck. Any swelling of the neck, lymph nodes, any like stiffness, limited range of motion?
Mm-mm.
Okay. Have you had any swellings of any glands that you've noticed under your arms? Any lumps, soreness of any breasts, sniffle discharges, or anything of that sort?
Nope.
Okay. So we'll go down to your kind of chest, respiratory area. So have you had any cough?
No.
Okay. So I would ask for speed and production, but you don't even have a cough. Any shortness of breath, wheezing, history of like asthma, pneumonia, bronchitis, emphysema?
No.
Any exposure to TB? You already said no.
No.
Okay. Cardiovascular, any heart problems, hypertension, chest pain, heart murmurs, any exercise intolerance, any palpitations, any edema, or you feel like edema in your legs, any redness or swelling, or kind of like a different discoloration you've ever noticed?
No.
One more swollen than the other?
Mm-mm.
Okay. And any history of like rheumatic heart disease?
Nope.
Any childhood like murmurs or anything of that sort?
No.
Okay. GI. So what are your bowel patterns? As like your stool characteristics? You know, us nurses love to know about that.
No, yeah. Normal. 2 to 3 times a day.
Okay. When you say normal, is that means brown? Is it darker? Is it soft, formed? Is it like Cocoa Pebbles?
Brown. Normal
Okay.
color, I guess. And then normal. Normal.
Like soft? Is that normal?
Like-
What you're saying?
Yeah.
Okay,
Yeah.
but not loose.
Correct. Yeah.
Okay, awesome. Any history of like rectal bleeding, abdominal pain, any ulcers, gastric ulcers, GI bleeds, any vomiting, diarrhea, constipation,
Not at all.
swelling in glands in the groins,
Mm-mm.
any history of peptic ulcers, gallbladder disease,
No.
or hepatitis?
No.
Okay. We are almost done. Thank you so much.
Yeah, of course. Yeah, no problem.
All right, so we're going to go to your urinary system. Any painful urination or bleeding while urinating?
No.
Any incontinence, so this can include like stress or urgent incontinence, like you really have to go, or like you'll sometimes like dribble a lot, something like that.
Oh, no.
Okay. Any like getting up to pee at night?
Mm-mm.
Any histories of like sexually transmitted infections
Mm-mm.
or urinary tract infections? Are you circumcised?
No.
Okay. What are your hygiene measures then? Do you recheck your foreskin?
Yeah.
Have you had any kind of infections of any sorts because of that?
Mm-mm.
Okay. Now we're gonna go down to your sexual history. This is just kind of routine. Do you have a sexual history with men, women, both?
Women.
Okay, and what are the practices? So like anal, vaginal, oral practices?
Mm-hmm.
All the above?
Sure.
Okay. And what are the number of current and lifetime partners?
Current 3, and then
Okay.
lifetime 10 or more.
Okay. Any contraceptives you use?
Condoms.
Okay. Let's see. Is the sexual activity currently enjoyable for your partner and for you? Partners?
Yeah, a good time. Yeah.
Okay. Based on your practices, are you concerned with any sexually transmitted diseases or any of
No.
that stuff?
I do not,
Okay.
actually.
If you have any questions or any concerns, you can always reach out to and we can always do those testings
Oh,
and stuff like that.
sweet. Awesome. Thank you.
So musculoskeletal, so any pain, stiffness in the muscles, joints in the neck,
No.
or kind of any extremities like limited range of motion,
Nope.
any weakness, impaired walking,
Mm-mm.
any swelling, anything you've noticed?
Nope.
Okay. Any histories? Well, you're young and healthy, so I'm not even going to ask that. 'Cause I'm assuming you're all very independent. So we're gonna go down to your neurological and psychiatric. So
Okay.
any histories of head injuries or loss of consciousness, problems with coordination, numbness, tingling, seizures.
Concussion when I was younger.
Okay. What's younger to you?
13.
13. And what were you doing?
Playing baseball.
Playing baseball. Did you get like hit with
Just collision.
Oh, okay,
Yeah.
with another player your
Yeah.
age? Okay.
Mhm.
And what did they tell you with that?
Just nothing out of the ordinary. Just it was a regular concussion, and I was sidelined for a while. So.
Okay. Did you like pass out, throw up? Were there any other symptoms with that headache and concussion?
No,
Okay.
thankfully no.
Any impaired cognitive function? Do you have like a history of headaches? Any memory impairments? Irritability? Mood swings? Any feelings of depression or feeling down? Any suicidal thoughts?
No.
Okay. And then endocrine and kind of like any anemia, sickle cell traits, any history of like bleeding disorders. Have you had a blood transfusion in the past?
No.
Any thyroid problems?
Mm-mm.
Any endocrine issues?
Nope.
I also forgot to ask cholesterol. When they do the blood draws, have they had any
Nothing out of the ordinary. No.
concerning? Okay. And then any heat or cold intolerances?
No.
Okay. And then any time that you're excessively urinating or super, super thirsty or have these things where you're like super, super hungry?
Mm-mm.
Okay. All right. That seems just about it of your body systems. We'll get some labs and then we'll
Okay.
get you your vaccines and then we'll send you on your way.
Sweet.
Your blood results should be in a few hours. They'll show up on your My Chart. And
Okay.
if there's anything, I will give you a call. Again, if you want to go over any sexually transmitted questions, the diseases, preventions, any of that sort of thing, please reach out. Or we can also do that today since we're doing lab draws.
Okay.
And then I will go over kind of all the vaccine information too.
Perfect. That works.
All right. Thank you.
Yeah, no problem. Thank you.